A short PowerPoint presentation titled Labiaplasty Explanations and Outcomes. Many of my patients have asked for a short explanation of the procedure, as well as asking me to show some before and after results, and this presentation will attempt to do that. This picture on the right is an image that I downloaded from the internet just to show some anatomy. This demonstrates simple unilateral hypertrophy. The patient's left labia minora is large. Her right labia minora is normal size. You can see this is the labia majora. You can see the clitoris, the clitoral hood, and the perineum. There are different approaches for labiaplasty. The two main approaches are the trim method, which I do not recommend, and the wedge method, which I feel is almost always the best option. If you look at this image on the right, the trim method pulls the excess labia out and then simply cuts it off to reduce the protruding quantity of tissue. The wedge method takes a V-type wedge out of the labia, and then this point goes to this point. So anterior meets posterior, and you get a more natural rounded appearance without this plateau appearance that you can see with the trim excision technique. Here again is a random picture that I downloaded from the internet. You can see the patient pre-op. She underwent a trim procedure. Here she is post-op. You can see that she's flattened here, so she has less tissue, but she still has a great deal of clitoral hood tissue as well as some extra tissue right at the portion of the labia minora nearest the clitoral hood. And this is one of the main problems with the trim technique, which is that it does not tighten the tissue. It merely removes some of the excess. Here's one of my patients. On the left, you can see the pre-op before, and then on the right, you can see post-op only 3 weeks after. This was a wedge procedure. I made an incision there and an incision there, and then this point went to this point on both sides, and you can see that now you have these straight line labia minora. This little pink area is the actual incision, healing at merely 3 weeks. Here's another patient. She has a great deal of labial excess. Her labia are quite thick. She has excess tissue. She has a large amount of clitoral hood tissue as well. When I did this procedure, I did a wedge, removing this extra tissue. All right, and you can see that post-operatively, now the extra tissue is not protruding beyond the labia majora. The thing that you can't fix with labiaplasty is you can't fix the actual thickness of the minora. So she still has a fair amount of thickness of the tissues. It's just that it's not protruding beyond the majora. And you can see that it's a good contour and that there's a good distinct shape to each labia minora. Here's another patient. On the left, the tissue is protruding beyond the majora. She underwent a wedge procedure, and you can see now that the labia minora are distinct, but also protruding not at all. They are nestled below the labia majora. These little areas are where the incisions are. Here's another patient with a great deal of extra tissue. You can see that if I were just to do a trim procedure, you can see how the labia minora is so lax. If I were to do a trim, it would just get rid of some of this extra tissue, but you would still see all of this laxity. By doing a wedge, I can now get a straight line labia minora. I did nothing to the clitoral hood, but because the wedge puts tension on the hood, you can see now it's much straighter. The labia minora are nestled below the labia majora. Here's another person with much thinner labia to start with. much more on the right side, much less on the left. I made a larger wedge on the right, smaller wedge on the left. Preoperatively, you see this nice thin labia minora. Here's the labia majora. Nothing protrudes beyond the majora. Here's a patient with a great deal of extra tissue as well as a great deal of lateral clitoral hood extra tissue. Again, wedge, wedge. This time I also did ellipse of clitoral hood tissue so that now you have basically straight line labia minora not protruding beyond the majora. Here's a patient with a great deal of extra labia minora tissue, wedge, wedge, straight line minora. These little areas are the incisions. I think she has an excellent contour. Another patient, fair amount of extra tissue, wedge, wedge, straight line. White lines represent the incisions. This patient was complaining about tissue getting in the way. She is protruding beyond the labia majora, wedge, wedge. Here she is, straight line labia minora, not protruding beyond the labia majora. Excellent aesthetics. Another patient who had not just extra labial tissue, but also lateral clitoral hood tissue. So wedge, wedge, ellipse, ellipse. Here you have straight line labia minora. Last patient, excess on the right, larger wedge, small portion on the left. And when I say right and left, I mean the patient's right and left. Small wedge, pre, post, excellent contour. I hope this has been a nice presentation of before and after pictures. If you want to see a greater explanation about labiaplasty, please visit my website at clevelandplasticsurgery.com. And you can also call my office to see whether you can get a virtual consultation. The number is 216-393-9924.